Hey folks, Brandon with Low T Nation coming again from the kitchen like always. Today's video is going to be the first in a few on the myths and misconceptions. So it's going to be kind of a mini series on some of the worst myths and misconceptions that are out there regarding testosterone replacement. Today's video is going to be on the myth of low normal. Doctors will say you're low normal, so I'm not going to treat you. You know, that means you're low, but you're still within the range, so I'm not going to treat you. So welcome. Hang on for 1 second. We're going to get to that before the moment. If you haven't liked us on Facebook, it's facebook.com/lowtnation. Please do so, and also subscribe to our YouTube channel because we have a lot of these videos coming out. It's fantastic information. In my opinion, it's some of the best information that you can get on this without all the crazy bro science nonsense that's getting guys into trouble when they trust these people and believe them. So we're very good at this. We're extremely medical. We've actually taught over 1,500 doctors in our clinic how to do this. Okay, so you guys are in good hands with the knowledge that you pick up from us. But anyway, Facebook, YouTube, check us out. And today's video again is going to be on low normal. So what does that mean? Doctors always turn guys away. You know, guys will see the symptoms. They're like, man, I don't have any libido. My muscle's gone. It's replaced with fat. I'm exhausted all the time. I'm irritable and anxious. I'm a shell of who I used to be. And they say, wow, all of these are testosterone replacement criteria or qualifiers. So they go into the doctor's office and they're like, man, I have all these symptoms, and the doc will run blood work on you. Now the range is 350 to 1200. That's an incredibly wide range. It's almost by a factor of 4, right? And how you can be at the bottom of that and the top of that and still be normal is a little wonky, right? So doctors don't quite get this concept, and so you can come back at 425, for instance. You're within the range. You know, so doctor says, yep, you're within the range, man. Sorry, I can't help you. You know, you're normal. You're okay. And that's just not the answer, especially when the patient has all these symptoms, all these qualifiers. Now, the way that I wish most doctors would approach testosterone replacement is the way they do with thyroid replacement. You have to be symptomatically qualified, right? Because if you don't have the symptoms, there's nothing to treat. I mean, why would you take Synthroid if you don't have any symptoms of low thyroid, being hypothyroid? So you got to have the symptoms first of all. Also, they're going to look at the range of your T4, and if it's near the bottom, they're also going to look at your TSH range, which is a stimulator for T4. And basically, when your body gets low on T4, it raises up TSH. TSH stimulates the thyroid to make more T4, and it does this, right? More TSH, more T4. There's a feedback loop. Then it says, okay, I can relax a little bit. T4 turns into T3 and gets bled off, and then all of a sudden you get low on T4 and it pushes it back up. But if you're in a position where you have low T4 and high TSH, even if the T4 is within the range and you're on the low side, they're going to treat you almost every time. That's what we do. That's what good testosterone clinics do with testosterone. A guy could be near the bottom of the range, have the symptoms, okay? Then there's an LH qualifier also. LH is kind of like TSH. It's the stimulator for testosterone production. And that's one of the ways we tell if it's a primary hypogonadism or a secondary hypogonadism. But basically, anytime you have high LH, not crazy high LH, but high LH and low testosterone, that's your body's way of saying, man, give me some more. Like the pedals to the metal and the car's just not going very fast, okay? That by itself, as long as you have symptoms, is a good qualification as far as we're concerned for being a testosterone patient. Now, there might be a million disqualifiers. I'm not saying you're immediately on the program. It's obviously more complex than that. But just to see if the guy needs testosterone or not, you look at where his testosterone levels are. And we're talking about total testosterone levels. There's obviously free T levels that are even more important than this, but I just wanted to be able to communicate the concept. Okay, so let's not get hung up into, well, are you checking free T? Absolutely, we're checking free T, and it works on the same guidelines. But if you're near the bottom of the range, right, and you're symptomatic, and especially if you have high LH, man, it's a no-brainer. The patient needs testosterone. Now, if you have the symptoms and you're near the bottom and you have low LH, well, that's a curveball. Okay, that means your car's not going very fast, but you're not pushing the pedal. So what do? It's a little bit of different approach. That patient might only need HCG. You might ramp his testosterone production up by a factor of 2 just by giving him HCG. But if your LH is up and your testosterone is down, that means your body just can't make the testosterone that it needs to make anymore. Okay, so communicate that to your doctor. If he's a doctor that you can communicate that to, okay, say, look, treat this like it's a thyroid issue, would you? You know, my LH is up, that's TSH. My testosterone is down, that's T4. I have all the symptoms, like what would you do in that correlated situation? They're gonna say, man, that's a light bulb moment for most doctors. And if it's not, do not just stop there. Guys, low T causes heart disease, cancer, diabetes, obesity, all of these things, like osteoporosis, all of these things that kill people later on in life. Do not fall victim to a doctor's bad judgment and predispose yourself later on in life to those nasty diseases just because he doesn't know what he's doing. All right? Take the control of your hormonal health and find a doctor that'll treat you. Find a specialist near you. Typically, you're going to be treated better if you use a specialty clinic. And if you don't have one near you, use a clinic like ours that do telemedicine. We can treat patients in 48 states. You know, we do this as well as it can be done. So there are solutions out there and there are answers out there. So I hope this helps a little bit, guys, with explaining why just because you're within the range doesn't mean, you know, you can't be treated. I'll be honest with you, probably half of our patients are technically within that therapeutic range of 350 to 1200, you know, 350 to 500, something like that. Those guys are qualified symptomatically. Most of those guys have high LH. They're absolute fantastic patients that are going to get a lot of results. And another thing, guys, just because you're within the range, it doesn't mean that you only need to be at 600 or you only need to be at 1200. You can be at 350 right now and in your prime be at 1100. Okay, that means you need to be back at 1100. And that wide range is crazy, man. I mean, we don't know if a guy's going to get full optimal benefits at 450, 700, 900, 1100. That's why you need to use a specialty clinic that understands those subtle nuances of how to take care of patients on a testosterone program. Doctors have to obviously be looking at estrogen levels and DHT levels and managing all that as well if you're going to get the right response. But don't let a doctor tell you no. If you know you have the symptoms and you're near the bottom of the range, find a doctor that'll work with you or explain to you exactly why you're not a candidate. But if he just says, yeah, you're low normal, you're within the range, that's not a good answer, okay? So on our website at lowtnation.com, we actually have, I think it's on the blog, an entire blog post on 10 questions to ask your doctor to tell if he's qualified. And this is obviously one of the powerhouse questions that'll let you know if your doctor understands the subtle nuances, again, of keeping guys at different levels. Even some testosterone clinics push like everybody to 900. That's terrible. You don't do that. A lot of our patients get incredible results by going up to 500 or 600. You know, so we have a start low and go slow approach, and we titrate guys up to the point that they feel amazing, and they're not spinning a ton of estrogen and spinning a ton of DHT. So we mitigate those side effects by not overshooting a level and saying, hey, we got him to his optimal level. Well, it's easy to get somebody to 2 times their optimal level if you don't tread lightly. So make sure you use a clinic that knows what they're doing. If you guys have any more questions, hit us up. You know where to find us. It's lowtnation.com. We're on Twitter at lowtnation, facebook.com/lowtnation, and on YouTube, the channel name is lowtnation as well. So hope to hear from you guys soon. Hope this helps. Have a great